Hi, everyone. Thank you for taking the time to listen to our audio summary of the stakeholder meeting for our Prevention of Error-Based Transfers Southwest Spread project held on Friday, March 4th, 2022. We began our meeting by acknowledging all our partners and stakeholders who have been with us and supported us along the way for the past few years. They included clinician groups as well as long-term care homes and long-term care corporations. As a reminder for our attendees, we described why and how PoET came to be. Doctors Paula Chidwick and Jill Oliver developed PoET to respond to the errors in decision-making they recognized in long-term care, mainly surrounding understanding the principles of the substitute decision-making, knowing whether a resident is capable of making his or her own decisions, and lastly, knowing who the correct substitute decision-maker was at any point in time. As a result, they created the Prevention of Error-Based Transfers, or the PoET project, to help address these errors. The PoET Southwest Spread Project, or PSSP, is a project designed to bring PoET to southwestern Ontario long-term care homes. PSSP is supported by a contribution by Health Canada. We shared with the group the 4-week process by which our spread leader works with long-term care homes to integrate and implement PoET within their long-term care home. There are 5 reasons that we have found for why PoET is successful in our PSSP long-term care homes. Not only does PoET align with the values and mission and quality initiatives of long-term care homes, our spread leaders are able to work within the structure and the schedule of the long-term care home to empower and educate frontline healthcare staff, as well as, more importantly, honoring and advocating the wishes of our residents and helping SDMs understand their role in the decision-making process. With that background, let's dive into some of the results that we've gathered over the last 3 years. It was important for our team to demonstrate that not only was PoET able to reduce hospital transfers for our long-term care residents initially, but that this was sustained over a 1-year period. As this graph demonstrates, compared to the year prior, homes launching and implementing PoET were able to sustain a reduction in the number of residents transferred to hospital over the past 30 days. It was extremely encouraging and very important for our team to see that long-term care homes in the PSSP project were able to provide palliative care for our long-term care residents within their long-term care home. Compared to the year prior, there is a marked increase in the number of residents receiving palliative care in the location of their choice throughout the 1-year period after launching PoET in the PSSP project. In addition to the clinical benefit that we presented in the previous 2 slides, it's also important to show that both the frontline staff and administrative leadership felt that there was significant value in PSSP for their work in long-term care. In addition to seeing value of PSSP to their own work, roughly 60% and over 70% of frontline staff and administrative leadership respectively saw the value of PSSP for the long-term care resident. This understanding and engagement was vital for sustainability during this project. A key component to our stakeholder meeting was to hear back from our stakeholders on 2 important questions. We asked, what could implementation and sustainability of PoET look like across the province? With respect to sustainability, our stakeholders told us it was important to ensure staff buy-in, important to reinforce family and staff education about the Ontario Healthcare Consent Act, and it was very important to address the long-term care staff turnover that is so prevalent in the sector. With respect to ideas around implementation, they suggested incorporating PoET into current accreditation practices, advocating for Ontario health teams to include PoET in their priorities, to generate interest at the long-term care corporate level, and to demonstrate how PoET aligns with recent long-term care reports and legislation. The second key question we asked our stakeholders was who can support the spread and scale of PoET and in what ways? Overwhelmingly, our stakeholders indicated that the Ministry of Health and government funding was essential. Other ideas included talking to long-term care corporations to see if they would be willing to support the spread of PoET across their organization. From a provincial widespread perspective, ethical considerations and equity considerations such as geography and size, as well as access and barriers to access, were important. As a result, developing a virtual model and supporting that on an ongoing fashion was important. The role of standardization and accreditation was once again raised as a way to sustain provincial widespread. And lastly, engaging families and residents to advocate on their own behalf locally was very important. As we ended our stakeholder meeting, we shared our next steps with our stakeholders. PSSP will continue to launch in long-term care homes until September 2022, as well as actively recruiting residents and their family members to understand their experience with the project. We also hope to understand the impact on healthcare utilization with our planned health economic study, which is currently in. Thank you so much for taking the time to listen to our audio summary for our third stakeholder meeting for the PSSP project. If you have any questions, please contact us at poetproject@williamoslerhs.ca. For additional information and for some of the resources we created during this project, please visit us at www.poetproject.ca.